Okay, so a very warm welcome to all of you today for our webinar, which is on understanding forensic psychology. As you all can see, we are streaming live on Facebook, and this will also later be put up on our YouTube channel for all of you to view and review and keep seeing again in case there's anything you want to revisit about everything that you learned today. Before I get into the actual topic that is there for today, I would just like to welcome some of you who are new to our platform to understand who we are. So we are Emoticons India. We are a psychological counseling, testing, training, and research center. And one of the biggest aims that we have is to really spread as much awareness about mental health as possible, and have you all understand and really live in the world of mental health in the most positive and healthy and growing way that is possible for you all. So as you all know, of course, the topic for today is understanding forensic psychology. And you all can see that we have our guest with us, Dr. Haji. She's someone who has had immense experience in this field. And surely you have also read it in the captions and the biodata that we have been putting about her, along with the poster that you must have seen. But I would really like to say that we're really grateful to have you with us on this platform, sharing all the experience that you've had, all the work that you've done in this. And I would really like to hand it over to you so that you could tell us a little more about yourself before we get into the topic even deeper.
Hi, good evening, everyone. Thank you so much for such a warm welcome, Anisha. Sometimes I feel like when people introduce me, they're talking about somebody else. And I can't thank you enough for inviting me on this platform from the other side of the world. I'm actually in Miami, Florida. So I really, really appreciate this. Anytime anybody asks me to speak about forensic psychology, I get excited, even though I've been doing this for about 20 years. So my name is Dr. Lina Haji, and like I said, I'm in Miami, Florida. I am a clinical psychologist with forensic training. In the United States, you cannot call yourself a forensic psychologist unless you are board certified. So I stay away from that term, but all of my experience is in forensic psychology. I have a bachelor's degree from Lehman College in New York in psychology. I have a master's degree from John Jay College of Criminal Justice in New York in forensic psychology. I have a master's in clinical psychology from Albizu University in Miami, and I have a doctorate in clinical psychology with a forensic emphasis from Albizu University, also in Miami. So I went a little crazy with school. And I've worked primarily in prisons. I've worked in 9 prisons in 4 states in the US, California, Florida, New York, and New Jersey. Everything from a bachelor's level counselor to a clinical director. Prison is a very stressful place to work. So after 18, 19 years, I kind of moved into more of the forensic area, which I will explain further. I now do court evaluations, risk evaluations, competency evaluations, police evaluations, and I'm also the clinical director of a private mental health clinic here in Miami, Florida. So that is a little bit about my background, and I turn it over to you, Anisha.
Great. I think that gives all of us quite a good insight in everything that you have done so far, whether it comes to your actual academic base that you've created for yourself, along with how you've developed on it with all the experience that you've gained for yourself. And I think that really brings me to the very first question of it all, which is, when we talk about forensic psychology, what is forensic psychology? And of course, when we do get into forensic psychology, there is a lot of comparison and similarities that people put with it when it comes to criminal psychology. So how are the two different, and what would you say about that?
So forensic psychology is actually much broader than people think. And obviously, when people hear the word forensic, they automatically think of CSI and dead bodies and bullets and ballistics and things like that. Forensic really just means anything having to do with the legal arena. So forensic psychology is psychology having something to do with the legal arena. Now, again, that's a pretty broad area. So you have, I would say criminal psychology is actually a subdivision of forensic psychology. At least in the United States, we don't have criminal psychology per se as a division of the APA, but we do have forensic psychology. So forensic psychology is really, according to the APA, it's the application of clinical specialties to the legal arena. So the legal arena could be corrections, which is prisons and jails. That could be treatment. That could be assessment of psychopathy, sex offender assessment, psychopathy being trying to figure out if somebody's a psychopath. Sex offender assessments, trying to see the likelihood of recidivism. In other words, what is the likelihood that a sex offender, if released from prison, will reoffend? Or violent risk assessments. There's competency to stand trial. There's not guilty by reason of insanity evaluations. There are police evaluations, correction. So really, forensic psychology is anything having to do with anyone who has come in contact with the law. Now, criminal psychology is, I mean, those terms are used interchangeably a lot, but really criminal psychology focuses more on criminal behavior. So when you think of criminal psychology, you think of, I don't know how many of you have seen Silence of the Lambs, but kind of what Clarice was doing, you know, an FBI agent. It's a lot of profiling, profiling being looking at a case study or a crime scene and coming up with a profile analysis of what the offender would look like, or who that offender might be. So forensic psychology also involves civil law. So that would be how I would answer the main difference between criminal psychology and forensic psychology, but criminal psychology is really a subdivision of forensic psychology. Also, the APA is trying to open a new subdivision called correctional psychology, because correctional psychology is so specific to people practicing mental health in prisons and jails and any kind of detention facility, immigration facilities, things like that. So they're actually thinking of teasing out correctional psychology from forensic psychology, which is interesting and probably needed.
Yeah. Okay. That's like a very kind of sweet way that you've put really the difference across, which is very understandable and easy to see the direct difference between the two fields. And I think while you were explaining it, you did in some way explain the scope to which forensic psychology would work. But if you could give us a broader aspect of what one could do if they were within the forensic psychology field and if they were aspiring to become someone who's working in that field, what would be the scope of the work that they could see for themselves?
So absolutely. I think, again, a lot of forensic psychologists start out in corrections because where else to find a bunch of criminals in one place, which is a controlled environment. That's certainly what I did. I started out working in prisons at the age of 23. I had no idea what I was doing, and I just kind of was thrown to the wolves, if you will. So a lot of counseling, a lot of therapy, and I use the term therapy loosely because depending on which kind of correctional facility, especially in the United States, some states are very treatment and rehabilitation oriented, while other states are very punitive and do not really believe in rehabilitation of offenders. So sometimes treatment is just making sure somebody's not suicidal, whereas other times treatment is really focusing on cognitions, emotions, behaviors, trauma, the self, to ensure that that person is okay while they are in corrections, and to make sure they don't recidivate and lead a fulfilling life once they are released. So the scope of forensic psychology, I would say anybody who's going to get their master's degree, and again, I'm speaking kind of a little more from the United States perspective, but I'm assuming it's a little bit similar in India. Master's degree, master's level clinicians would probably focus more on, brief assessments and then treatment, usually in correctional facilities or with probationers or parole offenders. So once again, forensic psychology is a much broader scope. I opened my own forensic practice about 1.5 years ago called Rise Psychological Services. You guys are welcome to look it up. It's also on Instagram. And what I focus on now is, it's interesting because I focus on offenders as well as law enforcement officers, as well as victims. Because if you think about it, law enforcement officers, offenders, and victims are all part of the legal system, so to speak.
Absolutely.
But they're also very different. So I could be doing an assessment for psychopathy to see if somebody's a psychopath on a Monday. On Thursday, I might be doing an assessment to see a rape victim, how they're functioning, how they're doing, what kind of treatment they need. And then the next day, I might be assessing somebody who's applying to be a police officer to see if they are fit for duty, if they have the mental capacity, the emotional capacity to work with offenders. So I'm really lucky because my forensic practice has such a wide array of different kind of evaluations and treatment. But I would say most forensic psychologists focus on one specific area. I also have friends who do child custody evaluations, which is also considered forensic. I don't personally work with children unless they're juvenile delinquents. But, that's another area of forensic psychology. And what she does is she really just kind of does evaluations of the parents as well as the children to recommend what would be the best outcome for the child or children in terms of residency, in terms of visitation. So I hope I'm not giving you guys too much, but that's just to kind of show you the scope of forensic psychology is huge. And there are so many things you can do. I also work as a consultant. So sometimes I get hired on how to build programs for prisons. What would be the best way, how to staff them, what kind of treatment modules and things of that nature. So it's a lot. It's a lot. It's fantastic because people think it's very narrow, but it's not. It's actually really, really broad.
Yeah, and I think once again, the way you've just put it across, it's really opening everyone's minds. I'm hoping at least mine, it has opened up even more where, I'm able to see that it's not just one aspect of crime that we're looking at or a person who's actually committing the crime. It's actually everyone who's involved in the situation, whether it's absolutely. And I get to talk to a lot of lawyers and police officers and victims and judges and forensic work. Again, it really is broad. Another area I focus heavily on is competency, which I can talk about in a little bit. Making sure somebody is competent to stand trial. Malingering is my favorite thing in the world. For those of you who don't know what malingering is, in basic terms, it's faking mental illness. And of course, defendants and inmates have a lot of reason and secondary gain, as they call it, to fake mental illness. So that's another area of forensic psychology, which is really heavily in need and a great and rewarding. And then of course, I'm really focusing mostly on assessment, but there's also treatment. How do you treat psychopathy? How do you treat victims? How do you treat offenders? What kind of treatment? And when you're time limited or you're in a structured place, what are your availabilities? Some prisons I've worked in, like I said, they just want to make sure they're not suicidal or homicidal. It's very kind of risk management. Are you going to kill yourself? Or are you going to kill anybody else? Other than that, we don't care. Whereas California, which is much more progressive and treatment oriented, is very much, let's talk about how you became a criminal. How do you have a trauma history? Do you have antisocial personality disorder? And so really bringing clinical psychology, which is my background, into forensic arenas is kind of, it's a marriage of the two. Yeah, and while you're speaking about that, it really shows that as there are so many areas and so many factors that someone who's in the forensic psychology field needs to really take in, that definitely means there are a certain set of skills that they would require to really work in this field. So what would you say are some of, let's say, prerequisite or developed skills that you might have when you're in this field, whether you're working with, the child group or the adult group or just the other people around in the situation?
Yeah, so for the United States, to have a career in forensic psychology, you have to have at least a master's degree. Master's degree here in the US take about 2 years. Some of them are even quicker. You can do it in 18 months. And then, so you can work as a master's level clinician. Then if you want to take it a step further, which I certainly wanted to do, I knew I wanted to get my doctorate because I wanted to do more and learn more. Then you do either what's called a PsyD or a PhD. PsyD is a doctorate of psychology, which is what I have. PhD is a doctorate of philosophy in psychology, which is another avenue. The reason I chose PsyD is because I love clinical work. I despise research. I despise statistics, and PhDs are typically a little bit more research and statistic oriented. I'm not a fan of research, but for those of you who are, God bless you, because I need your research in order to do my clinical stuff. And that's just me. So a doctorate takes pretty much 5 to 7 years, and it involves 3 to 4 years of coursework and then a pre-doctoral internship. Actually, I have a video about it on my Instagram, how to become a psychologist. And as I was recording it, I was thinking, how did I do all this stuff? I don't even remember. It was so tedious. You have to write a dissertation, usually forensic oriented, and then you have to do a fellowship, then you have to get licensed. So it's a pretty tedious process. I don't regret any part of it, even the days that I was really broke and really tired. I'm glad I did my doctorate. Once you have the education, the master's degree or the doctorate degree, then it's kind of really figuring out, again, what area you want to go into. I would say the main skills for working in forensic psychology are, number one, a basis foundation of clinical skills. And clinical skills, as you guys probably know, involve knowing cognitions, knowing emotions, knowing behaviors, knowing your basic treatments, knowing diagnosis. Diagnosis is extremely important, and it really is my pet peeve because I find that people are misdiagnosed all the time. And misdiagnosis leads to poor treatment outcomes. It leads to treatment fatigue. I mean, we could have a whole, webinar just on misdiagnosis. I'll give you one I've seen quite frequently is, people malingering and being diagnosed with schizophrenia because they're medication seeking, or bipolar versus borderline personality disorder. People are so quick to say I'm bipolar. So I'll ask I call them my inmates. I'll ask my inmates, well, what makes you think I'm bipolar? Well, you're bipolar. Well, I wake up in the morning and I'm in a super good mood. And then by the afternoon, I'm just super pissed off and I want to kill everybody. Well, that's not bipolar. That's low frustration tolerance, And then I see them put on lithium and Depakote because nobody does the full assessment and they just kind of take their word for it. And there's so many consequences of that. I digress, but the skills required for a career in forensic psychology, I would say, are good, solid clinical skills. And then kind of knowing your strengths and weaknesses. I've had people who absolutely do not do well in prison. I've had people walk into prison, take one look and say, I can't do this, and turn around and do something. And that's fine. Prison is not for everybody. Knowing your strengths and weaknesses and your limits. For me personally, I thrive in prison, which is a little bit concerning if you think about it, but I thrive under pressure. I thrive under crisis. I love working with psychopaths. And for me, it's kind of a game, a chess game. And those are another skill set I think people should know: your strengths and weaknesses, where you're willing to work, where you're not willing to work. Another skill I would say those are the basic skills: a good clinical psychology foundation, and then learning kind of how to apply that and where you want to apply that. And also whether you're more interested in treatment or assessment, because those are two completely different areas. I've been lucky enough to do both at different times of my career, and I still do both. And also, you know, careers ebb and flow. I used to be very treatment heavy. I used to love to do treatment. I used to love to do therapy. And then I got to a place where I was kind of fed up. And now I'm very interested in assessments and evaluations. And that might change 5-10 years from now, you know, who knows? So those are the basic skills. I would say focus first on clinical work, good clinical foundation, and then go into forensics.
Mm-hmm. Yeah, I think those are 2 or 3 very important aspects that you've really taken up, where, you know, having your base ready, having a very clear understanding of where you are going to work, what you're going to walk into, and then further really understanding if you as a person are someone who would be okay and would be fine with working in that space, and if you have those strengths to work there. If not, working on those strengths, working on those weaknesses to turn them into strengths, or then finding a different sort of pathway for yourself. So I think that's really important. Another thing that I've really picked up from everything that you've been speaking, and knowing you a little bit, I know this is also something you're really passionate about and you really strongly, firmly believe in, which is really the assessment aspect of forensic psychology, about how you mentioned throughout up until now that you've been speaking, how it's really important to really assess how everything is going, and how assessment is one major aspect of forensic psychology. So what more would you like to then emphasize on when it comes to assessment?
So I think assessment is probably the most important thing in anything you do, whether it's clinical or forensic, because if you don't, you know, assessment is the first step usually. If you don't have a correct assessment, then all of the treatment is neither here nor there. I talked about one of my biggest pet peeves being bipolar versus borderline personality disorder. I see that a lot. Another one I see a lot is real, that I find very interesting, that I can speak to, is a lot of misdiagnosis of psychotic disorders, right? Mm-hmm. And I work with a lot of great psychiatrists, forensic psychiatrists, but psychiatrists, in my opinion, are not the greatest diagnosticians, and it's not their fault. They're not trained to diagnose accurately. They're trained to be symptom oriented. So if somebody comes to them and says, I hear voices, they kind of just give them Haldol and treat that symptom, which kind of drives me nuts, because, for example, I've met a lot of inmates who have said, I hear voices. And then when you do a little further assessment and say, well, what do you mean you hear voices? They kind of, you know, talk about their own internal monologue. Right. And maybe I'm going into a little bit too much of clinical assessment here, but some of these inmates have been misdiagnosed as schizophrenic when they actually have a low IQ. And so they've been put on these horrible, very strong medications, Thorazine, Haldol, Risperdal, because they've been told they have voices. But if you do a really thorough assessment and you talk to them a little bit more, you actually realize that they just don't know that their own internal monologue or their own thoughts are not voices, you know. And if you do an IQ test, and you can do a quick IQ test in 20 to 30 minutes, that's another very important assessment. You realize they have a low IQ and they're not properly educated on their thoughts versus voices. That's one I've seen that's actually very, very common. Another assessment, again, I can talk about this all day, which is malingering. You know, inmates and defendants have a lot of reason to malinger, and malinger being faking mental illness. Because, you know, usually going to the psych part of the prison is cushier and safer than general population, because a lot of them struggle with addiction, which could be a whole nother webinar. So they are kind of medication seeking, right? So they're malingering that they're hearing voices because they want meds, because they've committed egregious crimes like sex offenses or murders, and they're trying to hide. So you have to assess, because at the same time, you know, you don't want psych beds taken up by psychopaths who can then prey on the actually sick inmates. And I'm just kind of speaking more to correctional facilities at this point. But having a correct assessment of where inmates should be placed, what is their diagnosis, and then what kind of treatment they should get. You know, it helps with everything. It helps with security. It helps with employment burnout. It helps the patient, which is the first and foremost most important, you know. And sometimes identifying malingering and calling a patient on that is the best thing you can do for them, you know, and you're not always going to be liked. That's another skill. I should back up a little bit. You're not always going to be liked. Forensic psychologists are not, you know, usually the most popular, because we're the ones setting boundaries, calling people out on their stuff, confronting them. You know, we're not the feel-good therapist all the time. That being said, I've had a lot of absolutely wonderful success stories with very difficult patients and have gotten positive feedback. But sometimes we're the bad guy. Sometimes we're the bad guy. No, he's not. He's completely competent to stand trial, and I become the enemy, you know. But going back to assessments, so you have malingering assessments, you have psychopathy assessments, which is a whole nother webinar. Actually, I'm going to be having a link soon to assessment of psychopathy on my website. So if anybody wants to, and I'll put it on Instagram as well. If anybody wants to, you know, participate in that, that would be interesting. Psychopaths, correct diagnosis. If you can learn one assessment your whole life, it's my favorite. I would say the MMPI, which is the Minnesota Multiphasic Personality Inventory. It is kind of the gold standard. That could be a whole other webinar that I could talk about. I love the MMPI. But then malingering assessments, the MFAST or the SIRS, the psychopathy assessments. When I do competency assessments, there are certain assessments for that to try and see if somebody is malingering, being incompetent. Police assessments are a whole nother area. You know, I do the INWALD and the MMPI RF. I don't want to get too into the specific assessments that I use, but what I would say is assessments are really important in pinpointing the problem and the solution. That's the basic way I can say it. We cannot know what the solution is without knowing what the problem is first, right? So even if you're not a psychologist and you're not using actual psychological assessments, make sure that you're good in diagnosing. Make sure that you know your DSM-5. Make sure that you know what to look for. And that would be the most important thing in my book. Assessments are really everything, because misdiagnosis and people really misunderstanding the problem leads to, you know, a snowball effect of horrible decisions afterwards.
Right, absolutely. And from what you're saying, and of course, in general, when it comes to life, I mean, to the life of the inmate or anyone else, it's really important to know that when you're working with the people, you're working with them in a way that helps them to grow and improve, rather than something that's just helping them into going further into the addictions or sort of behavior that is helping them, let's say, mitigate their negative aspects in life.
Absolutely. You don't want to enable, you know, you don't want to enable, and you don't want to help somebody become worse, so to speak, even if they don't like you for it. Sometimes it's kind of like a parent, you know, your child wants to eat candy, but if they eat candy all day, they're going to be sick and they're going to have rotting teeth. So you have to take away the candy. So you're not going to be liked for the moment, but in the long run, you're doing the better thing. And that's a really good point, Anisha, that you're not always liked, clinical or forensic, you know.
Mm-hmm. Absolutely, yeah. And I think from all the types of assessments, including the importance of assessments that you've given us, I just wanted to ask kind of an add-on question to this. Is there anything specific or different that you might take when it comes to the younger age group, like the teenage or the young adult age group, that might be slightly different from all the other assessments that you might take?
Absolutely. I really think that child psychology and adolescent psychology is a whole nother ball game. And then child adolescent forensic psychology is even more specific. So I don't typically deal with children and adolescent that much. However, I have worked with juveniles. What I would say is so important when it comes to younger, children or adolescents is make sure you're trained. And if you're not trained, refer out. With children and adolescents, because their brain is still developing and it's so much more fragile to even label a child or an adolescent with a diagnosis or give them the wrong treatment, knowing that they're still developing. It's such a huge it has such huge consequences that I would say, if I give one piece of advice, it's make sure to get collateral records, especially with children and adolescents. Find out about schooling, ask their parents, ask their friends, their family, their teachers, you know, all of those, look for other reports, because with children, you know, it can ebb and flow even more than adults. And again, because they're still developing, I would say when it comes to children and adolescents, collateral records, doing good background investigation is paramount. I mean, it's paramount in any assessment, but much more with children and adolescents. Absolutely.
Right. Okay. And from what I'm hearing from you is that there seems to be quite a relation between, of course, while you're assessing something, that is one important aspect, but also seeing how their behaviors in general are and what they are looking like and what they are doing in their overall time there as inmates or just kind of serving their time. So what would you say is kind of an interrelation between, let's say, their criminal behaviors and the actual assessment that they do get, or the actual diagnosis rather, that they do get through their assessments?
Yes, absolutely. So I think really, you know, mental health diagnosis is very broad. For those of you who work in the field, you know that there are psychiatric diagnoses, there are cognitive diagnoses. Do they have a low IQ or a learning disability? And then there are personality disorders. Personality disorders are a much more pervasive pattern of characterological, for example, antisocial personality disorder, psychopathy, which is not in the DSM, borderline personality disorder, histrionic. So I think first, figuring out what the mental health diagnosis, so kind of going back to what I emphasize all the time, having an accurate diagnosis is absolutely paramount. Because then you'll know, is the criminal behavior kind of driven by the fact that this is an antisocial person and that, you know, there's really no remorse or lack of empathy and that they are driven by the excitement of crime committing, or are they committing crime because they have a substance use disorder diagnosis? Not that that excuses the behavior, but it explains it very differently than an antisocial person. So somebody who's addicted to opiates or alcohol or crack cocaine or whatever the drug of choice is, might have a very different criminal type of pattern than an antisocial person or a psychopath. Same with borderlines, you know, borderlines, personality disorder, or even bipolar disorder are people committing crimes because they're manic and they're sensation seeking and they're impulsive and they're just ready to do whatever because they're going with this mania. Or is it, you know, even depression or anxiety, you know, are people. So again, I think is criminal behavior and mental health diagnosis, absolutely, they're very interrelated. However, I should speak on this, is that there's a myth that crazy people, and by the way, crazy is not a clinical term, it is a legal term, but people think crazy people are more likely to be violent, and that's absolutely not true. If anything, people who are psychotic and who are really suffering from true mental health are actually less likely to be violent because they're very scared and they're suffering. You know, we need to remember that no matter what the label is or the DSM-5 diagnosis, people with mental illness are suffering, and it is our job, depending on what capacity you're working in, to ease that suffering or to pinpoint that suffering. So criminal behavior and mental health diagnosis, you know, that's so huge, and it depends on the criminal behavior. For example, somebody who's consistently sex offending, there is no diagnosis that makes anybody sex offend other than, you know, exhibitionistic disorder. I mean, sexual sadism disorder. I should backpedal on that. Those are actually mental health diagnoses, but that doesn't diminish responsibility. So criminal behavior, what is the criminal behavior? Is it theft? Is it murder? Is it murder because of psychosis? Or is it murder because of antisocial personality disorder? Is it robbery? Is it gang affiliated? Is it being pressured? Is it substance use driven? That's another reason why assessment is so important, because so often, you know, we see, especially here in the US, I don't know how it is in India, but you know, humans become inmates and now they just have a number. So you're putting a 45-year-old pedophile in the same arena as a 19-year-old who was selling marijuana. Those are two completely different criminals, and yet they now have to coexist under the same roof. And we cannot treat the 45-year-old pedophile the same way as the 19-year-old weed dealer. Those are just two completely different kinds of criminals and behaviors and age groups and all of those things. So of course, criminal behavior is interrelated with mental health diagnosis. You can't tease them out, really, you know, but it's our job to kind of try and tease them out, if that makes sense, because they're so different. You know, a mass murderer or a serial killer, which I've worked with quite a few, is completely different from, you know, a 19-year-old kid who maybe his father was in prison, his mother, you know, was addicted to drugs, and so he started selling weed to, you know, support his brother and sister. That's a very, very, very different kind of criminal. Again, it doesn't excuse his behavior, but it gives more of an explanation, you know, and so they have to be assessed and treated completely differently.
Yeah, and I think that's just so vital for everyone to know that, you know, the diagnosis would just kind of give you one kind of direction of how the treatment and the way of being with them would really impact further. And not every behavior could be justified, is what you're saying, correct?
Yeah, absolutely. And I know I'm very diagnostic heavy, and some people are anti-diagnosis because they think it's a label or a judgment. I don't think diagnosis is the be all and end all. I think we have to come at everything from a biopsychosocial model, which is biological, psychological, social model, because two schizophrenics and two borderlines and two antisocials, you know, will never look the same. They'll never look the same. And so I am diagnostic heavy because, as you said, Anisha, it provides a framework, a kind of a guidance. But of course, you have to individualize assessment and individualize treatment. So I should say that, you know, even when we say two schizophrenics or two bipolars, we're already throwing them in a box, and that's not accurate. I'm using that as, you know, because it's easy to clinically speak about it that way. But yeah, I agree. It's just a beginning to put a diagnosis. Everybody's individual. Everybody's going to present differently. Everybody's going to need a little bit of different treatment, of course.
Yeah. So I think that's kind of a broad way of seeing what it might be like for the inmates or the people who are committing the crimes, let's say, or the ones who are really suffering or having these kind of issues and problems that they're dealing with. But along with them, of course, there are their families, the people who are close to them, the people they've been related to, who had also, you know, going through certain things while they are with them. So have you had any kind of exposure where you've worked with them and, you know, they've spoken to you about how they have dealt with all of this that's happening around them, or if there's anything that you have provided them with that could help them in sustaining or coping better with kind of the situation as a whole, because I'm sure it's kind of traumatic for the family members and close ones as well.
Absolutely. And, you know, all the research points to the fact that a support system is an integral part of any kind of treatment, you know, whether it's medical treatment or psychological treatment. So this is another challenge that as a correctional psychologist or forensic psychologist is really hard, because your patients are incarcerated. So it's not like we can just call the wife or call the son or the family. It's very challenging. And a lot of times the family or the support system is, you know, they have their own mental health issues to deal with. There's shame, there's guilt, there's, dishonor, there's anger. There is being fed up. You know, sometimes I've called mothers of or wives of patients, and they say, you know, this is the 5th, 6th time he's in prison. I'm over it. I don't even want to talk to you. And I get that, you know, they're fed up and they want to place a boundary. Other times you have families who are, you know, I'm going to use very not great clinical terms, but over involved or dependent or enmeshed, and they're calling you all day long, and you're like, okay, well, the apple doesn't fall far from the tree. You know, the son is 40 years old and the mother's like, my baby did nothing wrong. And you're like, okay, mom, you need to kind of wake up to the fact that your son is not as great, as innocent as you think he is, you know? So it's so interesting because the family members are a whole nother arena and a whole nother set of challenges. Ideally, in a clinical setting, you would want to rope in as much of the family members and support system as you can. Even if they have their own challenges, you want to at least provide psychoeducation and support. But that's another challenge in prison because, again, you know, families are torn apart, or they're angry, or they're fed up, or they're shameful, or they're guilty, or they're, you know, and sometimes you see, you know, when you do take the biopsychosocial model, which is inclusive of all of the person's history, you see that there's a, you know, the identified patient or the inmate or the defendant, isn't alone in a vacuum. You know, usually there's a reason that they ended up in prison. Maybe the parents are unwell, or the wife, or, you know, there's a toxic support system. So it's a whole nother challenge. And I think we are very far behind on that. I don't think correctional facilities are anywhere close to, you know, bringing in family members as they should. It's also a challenge, you know, a financial challenge, a clinical challenge, a safety challenge, because sometimes I've spoken to wives of inmates who come in and they're smuggling them drugs, you know, and then the wife ends up getting arrested in the visitor's room because they're bringing drugs into the prison. So, you know, the levels of pathology and sadness and kind of other clinical issues spreads really far. But I have interacted with them, and it's a range of emotion as can be expected, you know, just as in clinical. You know, sometimes you talk to the parents or the spouses and they're fed up and they want nothing to do with it, and sometimes they're over involved, and sometimes they're angry, and all those ranges of emotions. So it's difficult. It's very difficult and challenging.
Is there anything that you've provided to any of them, like any kind of coping skills or any kind of sort of ways in which it has helped them in further growing or getting better, the family members, which has also then helped the inmates?
So I think, unfortunately, because with incarcerated offenders, it's so hard to kind of build any rapport or any kind of alliance with the family members, and it's almost even frowned upon. I mean, we are very behind on that. I haven't had much chance to do that. What I will usually do is provide the family members with external resources, because, you know, it's almost too much to treat the offender and have to treat the family under these circumstances where you're not able to treat them as is clinically appropriate. So I think the best bet is just to give them their own resources, you know, and separate that out. Also, for the provider, for us as providers, it becomes, you get a lot of burnout. You know, you can't save everybody. And that's, as I'm sure you guys know, that's a whole nother webinar, not burning out, especially in forensic psychology. It's very stressful. It's very intense. And at some point you have to put a boundary. So my best advice or my best skill as somebody dealing with family members of offenders is to direct them with resources to handle their own health. That's the best advice I can give, or else it's just too much.
And I think that's a really important thing which you said right now about how even for the one who's kind of helping the inmate themselves, the practitioner, the psychologist there, it's quite a lot to deal with. And of course, if you're in that situation and working all the time, it definitely has some sort of stress and burnout and a lot of negativity which is there in these surroundings as a whole. So definitely there must be something that you must also be having to get back to and kind of get yourself sort of back up and recharge and just get yourself in a good position again. So is there something that you do like that you might want to share with us if you're open to it?
Yes, absolutely. And I really am big on breaking the stigma for mental health. So to be quite transparent, I have my own therapist, and I would not go I would not go a week without him. You know, I mean, I've seen things in prison that I really have really negatively affected me. I've seen violence, I've seen blood, I've seen murders, I've seen body parts, I've seen abuse. So, you know, I have no shame in saying that I keep my own therapist. I make sure to meet with my therapist weekly and to make sure that I'm okay, because I can't help other people if I'm not okay. And I think that, some parts of the world are a little more behind on that. In America, we're still behind on that, but we're much more open about it. I have all my colleagues, we all have shrinks. We all have, some of us are on meds, some of us are not. And we don't really have a shame in that. It's also easier saying that when you're in the field. So yeah, I keep my own therapist. Absolutely. I keep a support system. I have colleagues that I can speak to who also work in the field. So I've made it a point to reach out to people who also work in prisons, because really nobody knows what it's like to work in prisons except other people who work in prisons. So one of my best friends, she's a licensed clinical social worker in prison. We talk often. And humor, we use a lot of humor. You know, to work in prison day in and day out, you have to start laughing. You have to laugh or else you're going to cry. So I would say humor is a big one. In terms of self-care, which is really in vogue in the moment, I always make sure to exercise. I've practiced yoga. I've been a kickboxer. I CrossFit currently. I compete in CrossFit. So I make sure that when I'm out of prison or when I'm not at work, I'm not at work. Strict boundaries, you know. I mean, I'm not going to lie. Sometimes I take my computer home and I take my files home and things like that. But I try very hard to leave work at work, because if you bring the work home, you know, early on in my career, I used to come home and kind of not be able to sleep because I would be thinking about patients and what did I do wrong and what did I say wrong. And then, you know, through experience, I realized there's nothing you can do from your bed. You know, there's nothing you can do by worrying yourself to death. So kind of, I would learn to shut off work at work. So yes, I would say therapy, exercise, a support system, making sure you have hobbies, making sure you get, you know, good nutrition and good sleep. And not stretching yourself too thin, learning to say no. There are some times where people call me to do assessments and I realize I have too much on my plate. And even though it's tempting or it's something interesting, I have to say, no, I am sorry, I can't take that on right now. And that I'm not very good at that, to be honest, because I'm always like, I'll do it. Especially people in mental health, we're always like, I'll do it. Just give it to me. We want to save the world, you know? So we have to learn how to say no. I think that's really vital, both in our personal life and our professional life.
Yeah. And I think everything that you just mentioned right now, that is just so essential for us as mental health professionals or people who are getting into the mental health professional world, where you really have to take care of yourself as well while you're helping everyone else, and you're doing everything for everyone and you're being there for everyone. You have to be there for yourself. And I think you've really mentioned quite a lot of ways in which people can do it for themselves. And it's really wonderful to hear you so openly speaking about it, because not many do. Thank you so much for doing that.
Absolutely. No, I mean, listen, there are some things that are not going to change. You know, I'm obsessed with forensics. I come home, I watch Lockup, I watch Forensic Files, I watch serial killer documentaries. And my family is like, what are you doing? Don't you get enough of this at work? And I'm just kind of like, no, I don't. I want to watch more murders and more rapes and more stuff. And maybe that's weird, but you know, at this stage in my life, I've accepted it. I know when to turn it off and turn on some comedy and when to keep it on. But yeah, you know, we're kind of a quirky bunch in mental health. So we have to kind of embrace those things. I mean, I can watch murder documentaries till 3 o'clock in the morning and go right to sleep. And, you know, I've had to wonder, am I high on psychopathy? I'm not.
Yes. Right. Yes. That's really, really nice to have this kind of open conversation about it though. So yeah, grateful to that. And I think kind of just summing it up for my questions to you, and then we'll later open it up for all the others who have some questions. I've gotten a few in my chat box, which I will ask for them if they're not willing to, but I think from my end, one last thing is, a lot of things that you mentioned throughout till now about your some things that you've seen in the spaces where you've worked with inmates, and some of the harsh realities, some of, let's just say, basic reality of what it is like to work in those situations and those scenarios. Is there any kind of experience that you would like to share with all of us, particularly about what it has been or what has really gotten you even more strongly into this field of forensic psychology?
Wow, I have so many that I can think of. I can think of particular patients, and I think I'll touch on really briefly what it's like to be a woman in forensic psychology or in mental health. Is that, I remember I always knew I wanted to be a psychologist at the age of 9, just because I had gone through my own experience, and my parents were divorced, and I kind of went through a depression, and I won't get into my whole history, but I remember being exposed to mental health, thankfully, and thinking this is what I want to do. I just didn't know what population I wanted to work with. And when I was about 19, I took a class called Psychology and the Law, which was kind of a basic forensic psychology course. And this beautiful, tall, blonde, Barbie looking woman comes in and starts talking about how she works with serial killers. And I was just in awe, like, oh my God, this young, beautiful, vibrant woman is hanging out with Charles Manson. Like, this is amazing. And I was sold right there, And so I think to speak to, just the women for 1 second is, don't limit yourself. We can do anything that men can do. Any environment is challenging. But, and I've had to face sexism. Sexism from the inmates is one thing. You kind of expect it, and just, they are who they are. But when you get sexism from the bureaucracy and from the correction officers, you're like, wait a second, I'm supposed to be protected over here. So there are some challenges that I've seen there. I've also noticed, it's interesting, Anisha, you asked me how I would like to be referred to throughout this webinar. And I don't really mind if people call me Lina or Dr. Haji, but I found it a very interesting pattern in the field, which is that my male counterparts are always referred to as doctor, whereas my female counterparts are always referred to by their first name. And so, it's not a narcissistic thing or a pay me attention thing, but just kind of let it be even across the board. So things like that. Either you're going to call the male's doctor, but you're going to call me Lina. Well, we have the same degree, kind of that kind of thing. So I just wanted to touch a little bit about being a woman in the field of forensic psychology. It can be challenging, but there are definitely many brilliant, strong, amazing clinical people and researchers in the field of forensic psychology. And I would just like to end with just saying, it's hard, it's challenging, but I am never bored. I can say that. I am never, ever bored. I've worked in other places where I'm kind of like looking at the clock, like, oh my God, this person is going on for 10 more minutes, and I want to get home to my cat. I'm hungry. In prison, I go in at 8 o'clock, and mind you, I left prison about a year and left prison. I left prison about a year and a half ago to do this private practice work, but I'm never bored. And every time that I say, I've seen it all, I've heard it all, somebody else ups the ante, So it's never boring. It's absolutely fascinating. It's a clinical dream, because you see, I don't know how many of you have been trained on DSM-4, but we used to call it Axis 1 and Axis 2. You see all the Axis 1, you see all the Axis 2, you see all the addictions, you see the psychopathy. It's never boring. It's fascinating. It's amazing. And I'm just really grateful and really blessed that I have such rich experiences in the field. And, to have opened my private practice a year ago, I don't even know what's in store for me. I mean, just being asked by you guys to come on this webinar is such a huge blessing. So thank you again, because as you can tell, I can talk about this all day. You guys probably want to go to sleep.
Absolutely not. I think you kind of energize us to do more and more in forensic. Like, I don't know about the others, but maybe for myself, if I can talk, it's really encouraging me to look more into the field, read more, study more, maybe see how else I can do something about it if I can get into it. So, it's just really energizing me, and I'm sure it's energizing quite a few of the others who are there with us. And I think it's been really wonderful and our absolute honor to have you with us. So the thanks is from us. Yeah, so I think I would now like to open it up to the other members, the audience members right now, and perhaps we could do a quick 10 minutes if you're okay with that, Dr. Haji,
Sure.
because we're already at time.
Sure,
Okay.
you're gonna have to stop me because I'll do this until next Wednesday. So go ahead. You don't stop me.
All right, I'll be your sort of timekeeper then.
Perfect.
Great. So we'll just open it up for a few minutes for the audience to ask your questions. One by one.
Doctor, yeah, can I ask?
Yes,
Anisha
please go ahead.
Sharma ji. Yeah. Dr. Lina Haji, very good evening, and hats off to your deliberation. It was very enlightening and very, very dashing. It was very, very encouraging also for us, because you have a steel body and a nerve type mind. You know, with that mind you will be dealing with the psychopaths and going to prisons and handling all such of things. So really, you have made yourself very strong like iron. So my question to you, ma'am, Doctor, ma'am, that how do you, when you are moving with such people and you are solving their issues and you're handling them, how do you burn out, means solve your burning out, you know, like you may be involved in so much. So at the same time, you have to be also went out, you know, you have to, like the heavy burnouts, the same kind of routine and all. How do you want to means have a pleasure and again you rejuvenate yourself and come back, ma'am? This is a great quality you are having. Thank you, ma'am. God bless.
Thank you so much for your question. It's a great question. And to be perfectly honest, I'm not very good at, treating myself. I think as mental health providers, we tend to overextend ourselves all the time. But actually, about a year ago, I left the prison because I realized that I was becoming desensitized.
Okay.
People would, it was actually, a form of, I have to do something different because, I would see these horrendous things and hear and see suicides and homicides, and I would go to my office and just eat lunch, and I thought, oh my God, like, I'm really becoming too desensitized. They would tell me, well, this inmate was murdered, and I would say, well, are we ordering pizza? And not because I'm a horrible human being, but because I was really desensitized. So I think one of the reasons I decided to leave prison was because I realized, and I may go back, and I still do some work on the side. But I realize I don't want to be like this. Again, kind of to Anisha's earlier question, making sure I exercise, sleep, nutrition, have a support system. I have my own therapist. I'm lucky enough to live in Miami. I go to the beach. I ride a motorcycle. I go to eat. So anything I can do that's completely separate. If I have to just stay at home all day and watch Netflix, then that's what I need to do, and that's okay.
Yeah, really great. You are a great adventurous woman, great adventurous. So I'm really highly inspired by your this way of your approach, talk and all. Basically, doctor, I am also clinical psychologist and a mental health professional from Bangalore. So I understand your feelings and your things, and how you are connected with forensic. It's a really great that you are done, because here all the clinical things can be applied there, and you can do justice to forensic science, and even those perpetrators and all, you can mend them, help them to means have a good society coming years. Thank you, ma'am. Thank you. God bless.
Thank you.
Thank you so much, Mr. Shiv Kumar. I think now Miss Jessica Tanya had raised her hand, so we could quickly have a question from you.
Okay, thank you so much. For the time, I'm Jessica from Indonesia, and I want I wanted to ask you a question about the difference between criminology and psychology forensic. I still cannot distinguish it because it seems have the same field. Yeah, so please, can you enlighten me the difference between them? Thank you.
Yeah, absolutely. Thank you so much for your question, Jessica. So criminology is an area which really focuses heavily on crime, crime itself. So for example, criminologists would look at where a murder took place and kind of analyze the scene, the weapon that was used. It's a bit more forensic science heavy, and criminology kind of looks as to behavior profiling. If you're interested, I would recommend Silence of the Lambs. It's an amazing movie. She played a criminologist, an FBI profiler, whereas forensic psychology focuses more on the individual, on the actual person, and their mind, and their emotions, and it's actually psychology of the human. Whereas criminology is more the study of the crime, if that makes sense. The crime, the weapon, the ballistics, the science, the actual criminal act. I hope that answered your question.
Yeah, it did. Great.
Yeah.
All right. So I think I'll move on to the next person who has raised a hand. And just a disclaimer to everyone, there's a chance we may not be able to take all your questions right now. But Dr. Haji, if that's okay with you, perhaps if they don't get answered right now, I could just take them down from everyone. You could send it across to us. You'll get our email IDs and contact details in the chat box soon. So you could just send it across. I'll send it over to Dr. Haji and we will have them answered and sent to you. Yeah.
Absolutely. And feel free, I was just typing in the chat, but I'll just say it here. Feel free to, if you go to Instagram, I think my Instagram is @Rise Psychological Services. I might not get to it immediately, but send me your questions there, or even on my website. I think there's an email link on my website. It's risepsychological.com. And I will be more than happy to answer any questions.
Definitely. So great. That's wonderful that we have such an open guest with us who will definitely be willing to answer everything for you. I'll just quickly go to the next and possibly last question that we may take up right now. So Miss Akanksha Dash, I believe, is the next person who raised the hand. You could just.
Hello, ma'am. It was like such an this was going on. I am a school student, and right now there are a lot of options that are like provided to us, like career options, and having so much detailed information about a career has like helped me a lot. So my question is that, like, what tactics or like how, like, can you give me a detailed explanation about how would you detect malingering? Because it's like same as pretense that I would say in our age, because in my teenage, like I'm a teenage, so right now there's a lot of people who pretend a lot, like, yeah. So what tactics do you use?
Oh, that's such a good question, Akanksha. I could have a whole nother webinar on malingering. But so I think malingering is my favorite. I think yes, people are faking a lot, both in and out of forensic settings. I think there are psychological assessments like the MFAST and the SIRS that I can certainly speak to. I mean, we don't have time today, but when it comes to malingering of inmates, you have your best, or with anyone, I would say, does what they're verbalizing match the patterns of their behavior? Okay, so it's not just, because when people come and say, I'm hearing voices, and then they pretend they're hearing voices, that they can maybe manage that for 5-10 minutes, right? But if you go ask the correction officers and ask the people who are with them all the time, oh, well, he was playing basketball just yesterday and he did not seem psychotic at all, then you realize the pattern of behavior is not matching what he's telling you, right? When it comes to peers and people who you think are faking mental illness, maybe in your school or something, it's really the same thing. If they're saying they're depressed or they're manic or they're bipolar or they're hearing voices, and you see that their patterns of behavior over the courses of days and weeks are not matching with their words, you know, if there's a discrepancy, then that would bring to your attention, and always ask questions. Always ask questions. You hear voices, well, tell me what that means. Are they inside your head? Are they outside of your head? Also, I'm going to be having not a webinar, but same like I'm going to have a training on psychopathy. I'm going to have a training on malingering on my webinar as well, coming up in the next couple of months. And I'm going to try to make these trainings, you know, pretty inexpensive, and maybe have some scholarships, and they'll be pre-recorded. So I think there's a box on my website that says subscribe to the newsletter. If you guys just put in your email, I can certainly send an alert for when these trainings go up. So I will actually have a training on malingering, and I can go into that in more detail, but it's a great question. Thank you.
Thank you so much, ma'am.
Great. And perhaps what I could also ask from you, Dr. Haji, is if you could let us know whenever you have anything like this, and maybe we can share it across with our community in our network. And I'm sure they would be more than happy to attend if it's possible for them.
Absolutely. I plan on, you guys have been so great. I plan on staying in touch. And so again, feel free to go to my website, my Instagram, ask me questions. And Anisha, I can certainly let you know anytime that I have anything coming up like that.
Perfect. And
Anisha ma'am, with your permission, one small question.
Sure, maybe we
1
can.
minute only. Can I ask?
Dr. Haji, are you okay?
Yeah, only one small.
Yeah. Okay.
One small question.
Sure.
Yeah, Dr. Haji, actually, you have been experiencing with the clinical psychology background and now forensic. So now you're dealing with the psychopaths and perpetrators and all those such kinds. My question to you is, these psychopaths also have emotions. They are also human beings. Okay, they also feel bad and good and bad. All those kind of emotions are there. Whether when they are committing any crime, will they get intoxication, or is it without intoxication, or is it like an antisocial element in this? So which are these features are there so that they commit such a crimes, you know, the heinous crimes? With your experience, I wanted to just do.
Yeah. So again, that's a pretty loaded question, and I would really recommend, just in the interest of time, that when my psychopathy training comes out, that you sign on to that, because it touches on that. I think, you know, psychopathy is a very distinct personality. People who are actual psychopaths, and not everyone in prison is a psychopath. Let me make that very clear. It's actually only about 21%, which is still high. But psychopaths, true psychopaths, your Ted Bundys, your Jeffrey Dahmers, you know, your true psychopaths, those people, they have very limited emotions. It's actually neurological in the amygdala and the prefrontal cortex, and they are not capable of experiencing remorse and empathy. Without getting into too much detail, so that would be psychopaths. Antisocial personality disorder is a bit of a step down, and then you have your, you know, criminals who, of course, they have a full range of emotion, and you know, they're capable of feeling everything, and so I don't want to go into too great detail, because again, I could talk about psychopathy for 4 or 5 hours, but my best recommendation is to attend my psychopathy training, which hopefully will be up in the next month or two.
Yeah, surely. If I get invitation, I will definitely join, ma'am. Thank you.
Yes, definitely. And if you guys can see in the chat box, we've also shared Dr. Haji's Instagram link.
Oh, perfect. Thank you, Anisha.
Yeah, so you guys will have that. And definitely, we will try to do more with Dr. Haji and get you guys more and more material and exposure to forensic psychology with her. And I really just hope that all of you have gotten a lot to learn from this and have gotten more to gain about the forensic psychology field. And once again, Dr. Haji, thank you so much for being with us.
Thank you so much, everyone, for having me and being so warm and welcoming. And Anisha, you were fantastic. And I hope we speak in the future and stay in touch. And thank you, everybody. Have a really great evening.